Hi, my name is Diana, and I have been a nurse for about 3.5 years. I started my nursing career in a telemetry unit, and I worked there for a couple months before I transitioned to the ICU. I have been in the ICU ever since. I love working there. I love the pace, the ongoing complexity and acuity of patients, being able to take care of a severely ill patient and then discharging them home is very gratifying. The ICU has taught me the necessary knowledge and skills I feel like are needed to advance in my nursing career. In my unit, I'm currently part of several committees, which I feel like have helped me gain knowledge as well. Some of them are the education committee, where I do have the opportunity to teach other staff members certain skills that are required in the ICU. I am also a part of the staffing committee, where I participate in staffing and create the unit schedule. And then I am also a part of the neuro committee, where I did receive a specialized training at the University of Utah in their neuro ICU, and am just available when we do have a neuro patient on the floor. My ability to succeed goes hand in hand with what motivates me to become a nurse practitioner. Coming from immigrant parents, I have experienced firsthand the need for diversity in the healthcare system. I can remember being as young as 10 years old and going with my parents to doctor visits and basically having to translate the meeting for them. With that, and because of my parents' status here in the country, I did had to basically navigate school for myself. All the way from, I can remember, elementary to even college. I had to sign up for my own classes and had very little help. But I believe this is what pushed me to be the best I can be. My family and parents have been the biggest influencers in my nursing career. Once again, seeing that need for diversity pushed me to become a nurse, and now the need to advance my career to a doctoral level. A DNP will advance my career because I will be able to apply the skills and the knowledge I have gained as a nurse into a much needed change. As a bedside nurse, I have seen the gaps and areas where improvement is fundamental. And as a DNP, I can apply interventions where those gaps are. The DNP FNP is a doctoral degree in family nurse practitioner. As outlined by the AACN, an advanced practice nurse is any form of nursing intervention that influences healthcare outcomes for individuals or populations, and includes provision of indirect care, and some areas can be administration, leadership, health policy, informatics, and even a population health. NPs have advanced clinical training in addition to their role as a registered nurse degree, and are able to evaluate patients, diagnose, they can initiate and manage treatment, which includes both pharmacologic and non-pharmacologic treatment. They're able to order and interpret diagnostic tests, coordinate care, and above all, provide holistic care to the patients and families. The AACN also states the need for the highest level of education in those practicing, especially with the challenges and complexity of healthcare. Even more so now as we face this pandemic and policies are changing for NPs just to meet the surge for healthcare providers. A while back, the National Academy of Sciences called for non-research clinical doctors to prepare practitioners who can serve in clinical faculties. I am ready to fulfill this role, and admissions to the post-BSN DNP FNP program at Weber State will aid me in my success to meet all core competencies as outlined by the AAMP. My personal goal as a DNP is to help my community and be a leader to those that need it the most.